Welcome to Medicine with Dr. Moran. I'm Dr. Keith Moran. Today we're going to talk about constipation treatments. My cat Zorro here jumped up on my table before we got started, and I think he wants to be part of the show, at least at the beginning here. My patients often ask me what they can do to help themselves with their constipation, and this is why I've made the video. Watch and learn. Constipation is generally defined by a number of criteria, as you see listed here. These are formal medical criteria, which we call the Rome 4 criteria. These criteria were put together by the Rome Foundation, and the foundation itself is based on a number of experts who originally, back in 1988, had a meeting in Rome. This continues to this day. Constipation is defined as any two of the following features: sensation of incomplete evacuation, lumpy hard stools, straining, decrease in stool frequency, less than 3 bowel movements per week, the use of digital maneuvers to get rid of the bowel movement, and sensation of anorectal obstruction or blockage with at least 25% of bowel movements. This is more common as patients age. Laxatives are used daily by 10% of older adults and 75% of nursing home residents. It's a very common problem. Risk factors for constipation include female gender, physical inactivity, certain types of medications, depression, as well as associated illnesses. Diagnosis. This is based on your symptoms and physical examination. A review of medications is important. Drugs such as narcotics, certain blood pressure medications, antidepressants, iron, as well as some seizure medications are common causes of constipation. Parkinson medications also are a cause. You can of course check your side effects for each of your medications to see if there's anything that you're taking that's relevant to you. That's easy enough to open up the packages of your medications or the slip that your pharmacist will give you about side effects and how to use your medications. Remember, if there's a recent change in bowel habits, blood in the stool, weight loss, family history of colon cancer, further evaluation is important because the constipation may be something with a serious underlying cause. Please review your symptoms with your physician to see if any blood work or additional tests are required. Next, I want to talk about treatments. Review medications and avoid anything that might be causing constipation. Changing behaviors, increasing fiber, and lastly, a trial of laxatives are what we will do. First, behavioral changes. The bowels are almost always active following a meal or drink. This is often the time when stools will pass most readily. If you choose to ignore your body signal, the signals will become weaker and weaker over time. Pay close attention to signals because you may have an easier time with a bowel movement. An increased fluid intake is often recommended as well as exercise, but there is little evidence to support this. Despite this fact, physicians do encourage regular physical activity and fluid intake of 1.5 to 2.5 liters or 6 to 10 cups per day. Avoiding dehydration is certainly important. A regular bowel regime can be attempted. Most people with a normal bowel evacuation have a bowel movement approximately the same time each day. This suggests that having a bowel movement is actually part of a conditioned reflex. The optimal time for a bowel movement is usually within the first couple of hours after waking or after breakfast. One can try to retrain the bowel where you attempt a bowel movement 30 minutes after a meal. Make sure that you reserve time to have a bowel movement. Do not sit on the toilet more than 10 minutes at a time. Make sure you are sitting upright with your knees as high or slightly higher than your hips. A small footstool can be used if the toilet seat is tall. Drinking a warm beverage in the morning with a high fiber breakfast can also be helpful. Dietary fiber is the edible parts of plants that cannot be digested. It is seen in all plant foods, including vegetables, fruits, nuts, seeds, grains, and legumes. Fiber increases stool bulk, which causes the colon to distend and will promote stool movement through the colon. A fiber intake of up to 25 grams per day for females and 35 grams per day for a male is often recommended. This is good advice. The effects of fiber on bowel movements can take several weeks to come to fruition. Bloating and flatulence, though, is a common problem with increased fiber intake, and generally one has to do this slowly. Many fruits and vegetables can be particularly helpful at preventing and treating constipation. This is especially true of citrus fruits, prunes, and prune juice. Choose fruit or vegetables instead of juice. There are many sources of fiber from vegetables, beans, nuts, and grains such as barley, oats, quinoa, whole wheat, bran, those sorts of things. Next, I want to talk about laxatives. There's a variety of laxatives available for treating constipation. Typically, a bulk-forming laxative, which consists of natural fiber, is what is tried first. Products such as psyllium, which trade name is Metamucil, or wheat dextrin, trade name Benefiber, are often prescribed first. These are over-the-counter things that you can purchase on your own. You should always increase the dose of these fiber supplements slowly because you want to prevent gas and cramping that might occur. Make sure, of course, that you take these supplements with plenty of fluids. The dose of psyllium or Metamucil is up to 1 tablespoon 3 times per day with onset of action in 12 to 72 hours. Stool softeners have limited clinical benefit, but they're often used. What a stool softener does is allow more water to come up into the stool. They have few side effects, but are less effective than other laxatives. Stool softeners are things like docosate, which we often prescribe 100 milligrams to 200 milligrams a day. If there is no response to a bulking agent like Metamucil or a stool softener like docosate, we often use polyethylene glycol, which is actually what we use for colonoscopy preparation. Low-dose polyethylene glycol, 17 grams per day, which is 1 capful, is helpful and well tolerated in older patients. Trade names are Miralax, Restoralax, and Laxaday. Higher doses, 17 grams twice a day, can be helpful, but can cause bloating and cramping. Alternatively, lactulose is another over-the-counter option, but generally it's less effective than polyethylene glycol and should be avoided in diabetics due to its glucose content. Stimulant laxatives such as Senna, otherwise known as Senokot. The dose of Senokot is typically 8.6 milligrams orally, or bisacodyl, another stimulant laxative 10 milligrams orally as needed, can be helpful. Both drugs, Senokot and bisacodyl, can be used on an as-needed basis. They typically work in 6 to 10 hours. These can, though, lead to low potassium levels, and the long-term safety of these medications have never been studied. I tell my patients to use these only as needed. Senokot itself can cause dark pigmentation of the colon, but it's not known to cause colon cancer or other colonic problems. There are narcotic blocking medications which can have a role in the treatment of narcotic-induced constipation, which can be helpful for patients with cancer who need to take pain-relieving narcotic medications. Obviously, tapering and discontinuing a narcotic medication is always preferable, but in certain situations, such as cancer, that cannot always be done, and unfortunately these drugs can be quite constipating. So utilizing one of these narcotic blocking medications can be helpful for constipation. Thank you for watching this video on the treatment of constipation. If you suffer from this problem, hopefully some of the above advice will be helpful to you. I'm Dr. Keith Moran. Get healthy and stay healthy.